Okay, we're gonna switch it up again. First we talked meningitis due to bacterial infection, then it was meningitis due to fungal. Now we're gonna be looking at viruses. Viruses are going to cause what is referred to as aseptic meningitis. Okay, aseptic meningitis means that the cerebral spinal fluid that is collected during the lumbar puncture will be clear of any bacterial fungal cells, that the protein and glucose levels will be normal. White blood cell count may or may not be off, but the patient is clinically presenting all the symptoms that we would associate with meningitis. We're going to see that in children, young children, 90% of viral meningitis, aseptic meningitis cases are going to be due to enteroviruses. Entero means enteric, gastrointestinal tract. So these are viruses that are going to be spread by fecal oral contamination, fecal oral route. Okay, fecal oral means that either the child has poor hygiene, okay, don't wash their hands after using the bathroom, touch stuff, some other kid touches the same thing, puts it in their mouth, there you go, or ingestion of fecally contaminated water or food. Viral meningitis, while still, going to be something that's going to require, immediate, hospitalization, is thought to be a milder form compared to bacterial or fungal. I mean, look at it, mortality rate of less than 1%. It will resolve completely within 2 weeks. This is different than bacterial or fungal, where even though due to the antibiotics, antibacterials or antifungals, the cells themselves, the bacterial cell, the fungal cells, their metabolites, the endotoxins, the LPS, the the fungal cell wall products are still going to be in the system, are still going to be there at the meninges, causing further inflammation. Diagnosis is going to be lack of bacterial or fungal cells in the cerebral spinal fluid. So from a clinician standpoint, patient presents in the ER, in the clinic, wherever, with traditional meningitis, severe headache, aches, pains, high fever, unable to bend their neck, things like that. You will start high dose, broad spectrum antibiotics, maybe even antifungals at the same time, just in case. Once the spinal tap has been done and the ID lab has reviewed and tested, then can switch over to antivirals. While you're in the midst of switching over to antivirals, the ID lab will do further tests to try to identify exactly which virus it is. When it comes right down to it, for most of the viruses that lead to meningitis, there's really not much to do. Yes, there can be continued for a few days antivirals. Patient has been admitted to the hospital, going to go through, do the whole supportive care, the palliative care, keep them comfortable, keep the fluids going, do whatever has to be done, get the fever down, probably prednisone or something to pull back the immune response, get inflammation down, relieve some of the pressure on the central nervous system. But there's really very few antivirals, and the antivirals don't always work. So many clinicians will still prescribe them, but mostly it's just going to be wait and allow the patient's immune system to clear out the infection itself.